Okay, I'm going to ask all our panelists to unmute themselves. Good evening and welcome. I'm Kevin Edwards of Allied Physician Group. Thank you for joining our Baby Basics Newborn webinar. We hope this webinar will provide you with valuable tools and information about your newborn. A few housekeeping details before we begin. We'll have time at the end for a Q&A. Most of the questions were sent in beforehand, but if we missed any, use the little button on the bottom of the screen. It says Q&A. You can send us a question and we will try to get to them. Following the webinar, we'll send you a link so you can view it again or share with others that you think might get some beneficial information from it. Again, thank you for joining us this evening. I'd like to introduce our moderator, Dr. Kerry Fierstein, CEO of Allied Physicians Group. Dr. Fierstein.
Thank you, Kevin. Thank you, Allied and Adjuvant, for putting this on. I'm Kerry Fierstein, Chief Executive Officer of Allied Physicians Group, pediatrician with 30 years experience, mother of 3, and now grandmother of 1.
Big.
Say hi. So this little one is almost 4 months old. So I know firsthand about all the excitement that comes along. And I also know about all the worry and all the questions, right? And the best, I know we have a lot from the registrations. We have a lot of first-time parents. We have some second-time parents, and we do have some grandparents. So grandparents, the best thing about having the baby is you get to give him back to mommy. So you don't have to worry if he cries. Bye. So it is a time of a lot of excitement, but a lot of worry. You want to do the right thing. You don't know what the right thing is all the time. So you've taken a great first step tonight. Not only are you going to get some great information, but you found a source that you can trust. And it's really important to have people that you trust that you can ask questions to, because you can't research everything. You're going to have a million questions every day. And the internet's a very wide and vast space. So it's really important that you have somebody that you can talk to. And Allied Physicians Group is one of those sites. We're all practicing pediatricians, board certified. And if you go to our website, there's a lot of great information. Some of these talks that we're doing today and that we've done in the past have all been videoed, and I've also done a series with the baby on baby basics, so newborn exam, first month exam, swaddling, all kinds of cool stuff about that. You're going to learn a little bit more about Allied during the presentation, but what's great about us is that we have the ability to give you the benefits of a small practice. We have partners on site, people that really care about the practice and what's going on. And we also have the benefits of a large group. So we have a lot of lactation and nutrition and asthma education and all those things, especially the lactation is something that you guys may want to take advantage of. And we do have a breastfeeding basic seminar that we did last month that we probably will repeat, but it's worthwhile for everybody to take a look at that. So I'm going to introduce our panel today. And well, I'm going to introduce them. They're going to really introduce themselves. So Dr. Janice Montague, she's from Tuxedo Pediatrics.
Hi, everybody. I practice in Suffern, New York. I'm a solo practitioner, and I've been with Allied a short 6 months. I'm happy to be here. Thank you.
And Dr. Tulika Narain.
Hi, I'm Tulika Narain. Welcome. I am a pediatrician for over 20 years, and I have 2 young adult children that have taught me quite a bit, so welcome to the talk.
And where's your practice, Tulika?
In Patchogue, sorry, SB Pediatrics.
And Dr. Mirkin.
Hi, Gary Mirkin. I am a practicing pediatrician in Great Neck, New York. Been in practice for about 35 years now, and also one of the founders of Allied and president of Allied Physicians Group. Happy to be here. Happy you're joining us.
Thank you. So we're going to start with the presentation. If you have any questions, you can throw them into the chat. We do have all the questions that people signed up with, and we're going to answer them all tonight. So I'm going to hand the presentation over to Dr. Montague.
Right, we're starting with hunger. I thought we were starting with sleep, so I'm just going to, doing the hunger cues. Here we go. Anyway, so I think the biggest thing that parents, young parents, especially new parents, really worry about is, how do I know my baby's eating or eating enough? And the biggest issue with that is knowing when they need to eat, right? And so I love to spend time discussing those hunger cues with them, right? So when your baby, especially if you're nursing, turns his head or her head towards the breast, that's called rooting. And sometimes they do this just naturally when you hold them. So it may not be necessarily because they're hungry, but that is one of the cues. A lot of times they put their hands in their mouth, they suck on their hands. Obviously, we all know babies cry when they're hungry, but I think it's important for us to realize that babies are probably even hungry before they really start hysterically crying. And especially with nursing, it's sometimes hard to get them on the breast if they're crying. So it's really a good thing to know when they're hungry before they really start crying. Other things are like they can lick their lips, they can just sort of open and close their mouth a lot, just being generally more fidgety and fussy, and trying to suck on everything around them. So that's how you know. And then clearly, what do we do about that, right? So usually, you're in the hospital, you're giving birth, and lactation consultant comes in, or a nurse, and they really try to get the baby on the breast if that's what you so choose to do. And a nursing baby will probably eat even sometimes every hour in the beginning, just to sort of get the breast milk going. The thing also in the first day of life is babies aren't that hungry and they don't need that much. So there's no need to really worry in the first 24 hours if they're getting enough or not. But the nurses obviously in the hospital and your pediatrician that sees you in the hospital will help you with that all along. Most babies will nurse about every 2 to 3 hours. That gives us about 8 to 12 feedings a day. In a 24-hour, we don't even know what days and nights are, right, when a baby comes home, but in a 24-hour cycle, they probably eat anywhere from 8 to 12 hours. And how much should you spend on a nursing session is hard to know sometimes, right? In the beginning, our milk's not really in, we're not sure, are they getting? So, we think 15 minutes on a side is good. And, if that's not working for you and you want to move to bottle feeding, we can pump and put it in a bottle or use formula. I think most of us know that either thing is fine. We always encourage nursing because of all the great, hormonal and great stuff with the immune system, but clearly it doesn't work for everyone, or some people can't. And that being said, formula feeding can go from about 1/2 ounce every 2 to 3 hours in the beginning, first 2 days of life. And then we probably move up to about 1 to 2 ounces or so at each feeding, probably the same 2 to 3 hours or so. And then you'll see by the time they're about 2 weeks, they're going to start, drinking about 2 to 3 ounces or so. I tell people to sort of follow their gut, because a lot of the times, if you are nursing, you really wouldn't know exactly what they're getting. So I don't want people to freak out so much over the amount, but are they satisfied? So does the baby fall asleep after he or she eats, right? Do they sleep for a nice hour or 2 hours, something like that? Do they seem just contented? And the other way we know, are they peeing? Are they pooping? And we want to make sure in the first 24 hours that a baby has one bowel movement. Sometimes they may not urinate right away. It may take 2 days. Most babies sort of do that right away. And then we look at how often, once they are peeing, they should have 4 or 5 wet diapers a day. And they should have at least a stool. Breastfed babies will stool with every feed in the beginning for about 2 weeks. And then you'll see it probably change. After the 2 weeks, they may go 4 times a day, 3 times a day. Some formula fed babies only go once a day. Some babies will go every few days, but as long as they seem satisfied, they're not in pain from being constipated, and you're obviously following up with the doctor. Most of us see our patients 2 to 3 days after the babies come home from the hospital. We weigh them. Babies lose weight in the beginning. They're going to lose a percentage of their body weight. We don't want it to be too much, so we're going to follow that. And in the meantime, by about 2 weeks of age, a baby's going to regain their birth weight. And then you'll know over time, you're going to be even better and better at this. So babies, you'll say, is my baby taking enough now that he's 2 months old or 4 months old? And as long as they're growing, right? They're growing, they're on their growth chart, they're sort of looking like they're healthy, their exam is healthy, and your pediatrician's happy about that. I don't sort of go by exactly the amounts. There are definitely rules of thumb, like 2-month-old babies, maybe they eat like, 4 to 5 ounces every 3 to 4 hours, and 4-month-old babies will take more, and then by 6 months, they're taking 8 ounces. But not every baby always takes 8 ounces, and some babies are still nursing. And when you're nursing, you don't really know, but are they growing? Are they peeing? Are they pooping? Are they satisfied? And are they getting longer sleep? So if they're getting longer stints of sleep, then you also know that they're satisfied. And then just in the beginning, you're going to monitor, like I said, their wet diapers, making sure they're peeing, they're pooping, and how they're feeling. That's pretty much it for the feeding. And then we're going to talk about sleep, which I think for me is probably the biggest question next to feeds I get. I think as the baby grows, parents become so much better off at the feeding and understanding the baby's cues, and oh yeah, the feeding are fine, we're nursing, we're doing this, we're fine, but the sleep becomes the issue probably for a year, I think a good year. And so remember in the beginning that a newborn's going to sleep even 20 hours a day. 18 to 20 hours a day for a newborn can be completely normal. Remember, in a 24-hour cycle, not necessarily what we know as night and day, right? As much as parents want to sleep through the night, their babies are going to eat. We want them to eat through the night in the beginning because we don't want them to get dehydrated. So a breastfed baby should probably eat still every 2 to 3 hours at night. Formula-fed babies sometimes can go a little longer, maybe 4 hours, because formula sort of sticks around a little bit longer. And then you'll see, as they get older, they can sleep longer, but they sleep less than a 24-hour period. They're going to have more alert times. By 3 months of age, many babies can sleep through the night. Through the night can mean different things to different people. It's not going to be like an 8-9 hour sleep, but they might sleep from 11 to 5. They might sleep 9 to 4 or something like that, which is about 7 hours or so. Some babies can do that right away, weirdly so, and other babies don't do that till they're 6 months. I tell people all the time, if only 2/3 of babies sleep through the night, whatever that means to you, is 6 months, at 6 months, and 2-month-olds and 3-month-olds not necessarily going to sleep through the night. The thing to really look out for is, are they wakeful during the night? Are they eating, sleeping, eating, sleeping? That's very normal. If they're sort of eating and cranky and up and don't want to sleep, then there may be a little bit of problem with their sleep. But I wouldn't even say there's a problem until they're older, 6 months or so, when they're really sort of looking around for mom and dad, pick me up, take me out of the crib. I don't like being here. This isn't fun for me. So always talk to your pediatrician about that. I talk about sleep at every visit because I like sleep, and I think that parents like sleep, and I think the better rested a parent is, the better parent you are. So always bring, and hopefully your pediatricians all bring that up, but you should feel free to bring that up too. We know that babies grow in their sleep, they learn in their sleep, their brains rest, it's important. And the most important thing besides the quantity and quality is to sleep them safely. So the AAP recommends that babies sleep on their back. Since 1991, we've had back to sleep. It has had a decreased risk of SIDS ever since then. The graph goes right down. Once we place babies on their back to sleep, they're much safer. There shouldn't be any smoking in the house. Smoking is also a risk factor for SIDS. Keeping it too warm in a baby's room is a risk factor for SIDS. We suggest keeping temperatures around 68 to 72 in a room. Seems to be the temperature that babies sleep well and safely. We should have a certified crib with a safe mattress, right? Fitted sheet, making sure there's nothing loose in the crib. If you use a blanket, it really should be tucked underneath, like you might see the nurses do in a hospital, underneath the The mattress, I'm not a fan of that anyway, because I think they can get loose if you've got a squirmy baby. I think that a baby, as long as they're comfortable, remember, if you feel their hands and their feet and they're sort of coolish but not freezing, they're comfortable. That's how you know a baby's comfortable. So you don't feel the need to really overdress them at night. No pillows, no blankets, no stuffed animals, no mobiles anymore, no bumpers. There are some safe bumpers that you can look for that have holes in them that allow for some safe sleeping. You know, another thing not to do is put them in your own bed. We recommend that babies sleep in your room for the 6 to 12 months, but next to you in a co-sleeper, in a bassinet, in a crib, in a safe sleeping environment. There are many examples, sadly, of parents rolling over in their babies falling out of beds. We don't want babies sleeping on a couch. We don't want babies in your bed. They don't want them on a too soft surface. We want them to be in a safe sleeping environment. The AAP also says that even a pacifier can help with sleep. It can help with sleep initiation, and it may be safe for SIDS prevention as well. Some people think it interferes with breastfeeding in the beginning, but you can offer a pacifier probably, you know, by 2 to 3 weeks. And I sometimes do it earlier. I don't think is a completely different sucking mechanism from breastfeeding and pacifiers. So I don't really find that it interferes with that too much, but that's sort of, I think, a personal thing. Don't have babies sleep in a car seat, right, or in a bouncy seat. It's really not safe. And if you do, when they're sleeping in their car seat, it should be not overheated, and make sure their little buckles are always on, because babies can slide out, and that's really unsafe. We don't recommend positioners anymore. That's another thing that could be dangerous for them. Make sure that if you're going to swaddle your baby, that we don't make it too tight, because we think that it could affect their hips. So we want to make sure, because those are developmental things that are going on with the baby's hips, that when we swaddle them, I'm a fan of leaving their hands out, because babies like to suck on their hands. You can do whatever you want. We think it's safe. Once the baby is rolling over, really moving around, we suggest not swaddling them anymore. They do like it for comfort. I have parents who come in and say, I'm not so sure this is a good thing for my baby. And I say, don't do it. As long as they're comfortable in their crib, they don't need to be swaddled. Sort of not one of those things that we really care either way about. That's it. Next up.
Okay, that's me. Congratulations, you have this new baby who looks absolutely beautiful, perfect skin, all that stuff. And now you have to take care of this baby that seems so delicate. They're not as delicate as they look, I promise you that. But I wanted to go through a few things that are important. Starting off with diapers, everyone has their preference, disposable, not disposable, cloth diapers. I really believe it's your preference in terms of what you choose to use. Remember, some babies, when they're coming out, their skin is very sensitive, and the first few times they poop, the first couple days, the area of skin may turn a little red. So frequent diaper changes, watch out for that. Some people recommend A&D ointments, stuff like that. I usually recommend that if there's a little bit of redness and you want to help protect the skin, then A&D ointment or something like that really can help. If it becomes a further rash or it's not going away with the A&D ointment, your pediatrician should be the one to take a look at that. With the babies also, they are growing at a tremendous rate. So not only do you have them gaining weight pretty quickly and everything else, but their nails are growing at a rate that makes most women jealous. They're very beautiful nails, and they're really thin. So at the beginning, you're going to find that you may not want to clip them. We do recommend filing them at the beginning, and it's nice and easy, just have to watch out. Occasionally you'll see you get a little bit of like a scratch on them. Don't worry, they heal well, and it should not be a problem, but they're very delicate. I recommend filing to start off with. The ears themselves, a lot of people get concerned about earwax, and with the ears, you may see a ton coming out. If you can see it and gently pull it out, that's fine. We do not recommend going into the ear itself. Not only can you cause damage to the ear, but we end up pushing a lot of the wax back into their ear. And the one thing you want to remember health-wise is that the earwax itself is very protective to those thin ears. There's actually really thin skin in those canals, so it really will help with a lot of that. When you look at the baby with the umbilical cord, you'll often hear from your hospital and your nurses on how to take care of that. And I've actually heard quite a bit of variation. You really don't need to do much with it except keep it clean and dry. You're going to make sure that area is not being soaked in water. So this is the reason they don't say any baths or anything like that right off the bat. but you don't have to put any special alcohol or anything on it at this point. If the area does look red and irritated, it does look swollen, it feels warm to the touch, anything like that, you want to reach out to your pediatrician and let them know. That's really important. Speaking of circumcision, that is really, whether to circumcise or not to circumcise, I really believe is a personal choice. It has not been shown in many studies to have a difference to their health. So it's really, really important. Most of the time, it's really the parent's preference. But once you do decide to get circumcised, once the circumcision is done, the hospital will go through with you on how to care for the skin. Takes about a good week for the baby's skin to heal in general. And the big thing is just to lubricate it, make sure it doesn't stick to the diaper or areas around it. That can become a serious problem. If you notice it looks funny, you often will see some yellow areas. Yellow and white areas are very normal of healing circumcisions, so don't be surprised on that, but anything else beyond that, you want to reach out to your pediatrician. Skin-wise, you have this beautiful baby, absolutely perfect, and then you find that their skin starts to peel over the first couple weeks. And parents are often wondering, why are they peeling? Very, very normal. I do say that you can use some hypoallergenic cream if you want to, but they will continue to peel. It's just a matter of going from where they were, which is a big water bubble inside you, out to much drier air. And so it takes time for your baby's skin to actually adjust to that environment itself. Next slide. Thanks, Kevin. So the next thing is, when should you worry? So none of the babies come with their own instruction booklets, unfortunately. So every baby is going to be very different. There are a couple things that we do run across. I'm going to go through a few of them with you. The biggest concern that people have is fevers and infections. Obviously, your pediatrician will go through some of the regulations. We're in COVID time, so I'm assuming that nobody's having huge parties at this point, but being careful with the baby around anybody else who may be sick. We want to make sure we're not over bundling the babies. That can actually be dangerous and raise their temperature as well. But if you feel like your baby's feeling a bit warm, it is a good idea to check their temperature. It is recommended to do it rectally. And most rectal thermometers, you only have to go in a little bit with some lubrication, and babies are annoyed, like most people would be, but usually they tolerate it pretty well. If you do find a fever of 100.4 or higher rectally, you do want to give your pediatrician a call. That could be something that's a little more serious, but again, remember, make sure they're not over bundled. That's one of the biggest causes of us seeing their temperatures going up. The other things that we see, hiccups, sneezing, a lot of those things are very common as babies are growing and they're clearing their airways. Hiccups is part of their developing nervous system. So you'll see that quite a bit. Again, they don't need any water. I know there's old remedies out there, like I've actually heard honey, which is dangerous. Things like that we want to avoid. They will work through it. Sneezing is very important to clear their airway as well. We often see, I'm going to bring one other thing in here, and that is, despite them being perfect, you'll also see some variety of rashes that come through. You may see red spots that come and go over the first couple weeks. That can be a very normal newborn rash. Don't panic on any of that. Touch base. You'll probably see your pediatrician a lot more than you like the first couple of weeks, and they can go through it with you. If it's coming and going and you're not sure, it's nice and easy to take a picture, let them take a look at it. A lot of times a picture is worth 1,000 words, and they can let you know what's going on. We do see a lot of babies in the first month or so with periodic breathing, and that's something that can be very concerning to see, but is very normal in all newborns. And that's when they actually start to take those fast, quick breaths. They go, and then they stop. And most parents are frantic for about the first 3-5 seconds that it takes them to take that deep breath again. Very normal part of their development as they're growing older, and that should pass over some time. The other thing that we see is eyes crossing. Sometimes you actually can see it when they're trying to focus on something, and some of that is just the immaturity. They shouldn't shake, they shouldn't do anything, but if they're focusing on something pretty close, a lot of times they actually will cross their eyes to see what's there, remembering that their vision over the first 12 inches is pretty good, even from the beginning of it. And before I go on, the other thing that I did remember, people bring up a lot of issues with poops and stools and all that stuff. And remember, there's a great variation even day to day on your baby. So there may be days that your baby goes 4 times, there may be days they don't go at all. as long as they're not vomiting, seeming uncomfortable, fever, and they're drinking okay, it may be completely normal to see. And Dr. Mirkin, that brings us to you.
Let's see, how to choose a pediatrician. The traditional way is to ask your neighbors, ask your family, ask your parents who you may remember who was your pediatrician. And I, like some of my colleagues, am enjoying having second generation pediatricians. Nowadays, a lot of people will go online, and I've actually had a lot of parents tell me that they found us on Yelp. It may be one way to start and get a list of names. I think another very good way is to ask your obstetrician, because your obstetrician's been dealing with a whole host of different pediatricians in your area, and probably has some preferences on who he thinks or she thinks might be good for your personality and good for your family. Once you have a list of possibilities, then it's a good idea to start calling the offices and ask to speak with the pediatrician and see what each office does. A lot of my office will set up consultations and have the parents come in, hopefully both parents, and we give a tour of the office and sit down and talk and answer questions, much like we're doing tonight. We try to let the parents know what to expect when they're going to go into the hospital and after the baby's born. A lot of pediatricians these days don't necessarily go to the hospital to see patients anymore. A lot of hospitals now have pediatric or nursery hospitalists that see the babies, and a lot of groups still go to the hospital and see the nursery. I find it one of the most rewarding parts of pediatrics, so my group still goes there. So when you go to interview the pediatrician, try and write out a few questions or important things that you don't want to forget to ask, and see how you feel. If you feel comfortable with the pediatrician, if you are comfortable with the way the office looks, see what services they can do in the office and what services or testing that they can do in the office and other testing that they may need to send out. There are a lot of things nowadays that can be done in the office, and it's nice to, in a lot of cases, be able to have results before you leave. I forget if I said, also ask your neighbors who they're using. If you live on a block with a lot of families, I'm sure they'll have some good suggestions for you. So that's my take on the pediatricians. Visits and vaccines. When you're ready to go home from the hospital, generally the pediatrician who's discharging you will let you know how soon to follow up with your doctor. When we're seeing our babies in the hospital, generally when they go home, we'll see them within a day or two, or maybe 3 days, depending on how much weight the baby's lost while in the hospital, depending on whether the baby's pink or a little yellow or jaundiced. So we decide on the day the baby goes home from the hospital. Once we have you in the office, we're very concerned about following the baby's weight to make sure the baby doesn't lose too much weight. And so we may see the babies even 2 or 3 times in the first week or two after you go home. Once we're confident the baby's gaining weight well, there's a schedule of regular visits that in our office, we usually see the babies once a month until they're 6 months old. Now with the dawn of telemedicine, some of these visits we may even do remotely, so you don't necessarily have to come into the office. We have up here the vaccine schedule. Generally, we encourage parents to have the baby get the first hepatitis B vaccine as soon after delivery as possible in the hospital. There's a lot of, there's no downside to doing it, and there is actually a small upside that, they found that some mothers, if the baby is exposed to hepatitis B during delivery and contracts hepatitis B in the neonatal period, it can lead to a very severe infection that can sometimes be fatal, and if not fatal, certainly lead to lifelong hepatitis B that can cause cirrhosis and liver damage. So I encourage all mothers to get the baby immunized while in the hospital with the hepatitis B. Generally, at the 1 month visit, we give the second hepatitis B, and then at 2 months, 4 months, and 6 months, we give the other infant vaccines. There are, I believe most pediatricians now are using a combination vaccine to try and limit the number of shots, individual shots that the baby gets. The reactions from the vaccines actually are far fewer nowadays than they used to be 30 years ago. Even though the baby's being immunized for a lot more illnesses, the reactions are far, far fewer. And so we normally give a combination vaccine that includes diphtheria, tetanus, pertussis, Haemophilus influenza type B, and polio. It's called a pentacell. That's in one shot, and the other shot is a pneumococcal vaccine. And then we also give an oral vaccine to protect against rotavirus infection. If you look on the Allied Physicians Group website, you can read about all the illnesses that these vaccines prevent, and they're very, very important. And I know coronavirus is top of mind with everybody, but as far as pediatrics and babies are concerned, this is a far, far, far greater danger that we're actually able to prevent nowadays. You'll also see when you go to the office that a lot of us are doing screening for maternal postpartum depression. We do developmental screens. We give out a lead screening questionnaire, and we also want to assess the risk for tuberculosis. I think I don't know if I have another slide. No, that's not me. I don't think it is. Anybody?
It's me.
Okay, sorry.
It came up quick. So this is right on everybody's mind. And nicely so, most babies are doing perfectly fine, even born to COVID positive moms. So that's like really wonderful. Even going back to a COVID positive household, we're not getting a lot of science or studies that show, even from China and other countries that initially surpassed us, that babies were particularly very sick. We don't think it actually transfers across the uterus, maybe the placenta. We're not really sure right now. It's sort of out there, and we'll decide, I guess, over time. But even so, if a mom is COVID positive, most of the hospitals are asking moms who are scheduled C-sections to get tested prior to coming in. Otherwise, our hospital is testing the moms as they arrive. If we're lucky enough to get those results back in 24 hours, we'll know. Babies born to COVID positive moms are suggested to get tested. It's a nasal swab. It's easy. It doesn't hurt. They don't really know that they're getting it. And they get tested at 24 and 48 hours of life. Would not hold up their discharge home with mom, but would just be something that maybe the pediatrician would want to follow more closely if the baby was positive. In our hospital that had a lot of COVID positive moms, we have not had one baby positive. We've had babies we've watched, we've had babies we were worried about, babies in the NICU, but babies are doing wonderfully. The suggestion is if a mother is COVID positive and symptomatic, that if we do rooming in or couplet care in the hospital, we can have a special nursery where we can have those babies and the mom can express milk and give it to another caretaker to feed, or we can keep them 6 feet apart in the room if the rooms are big enough, we'd like a curtain between. If there's another caretaker there, obviously we don't want the baby by him or herself on either side of a curtain. We'd want them 6 feet apart. If mom would really like to nurse, it would be gowned, gloved, masked, hand washing, really very careful about bringing the baby to the breast with a COVID positive symptomatic mom, but we've been doing it and babies are actually doing okay. Once they go home, we want to make sure the baby's still doing well. So we'll follow up with the pediatrician in a good 24 hours after discharge, if possible, would be good. Hopefully going with a COVID negative member of the household. What we would like ideally is still to keep that mommy sort of away from the baby if it's possible, and maybe express milk or make sure that that hand hygiene and that mask is on during nursing sessions. But the studies are really showing that most babies are born, they're doing well, and I think that really bodes well for them, because I know everyone's worried about the pregnant mommies, which is a very tough time right now, and also their older children. So I think this sort of cohort of babies is better off than some of our older kids and the pregnant moms. The other thing to note is it's really not passed in breast milk, so that's a good thing, and we're probably hopefully giving them some antibodies in breast milk, so that's another wonderful thing. That's all I got about COVID and babies.
Okay, my turn. So this is a really, really important topic for me. You have this beautiful baby and everyone's attention now goes towards the baby, and that includes your own. What we find is over the next couple of weeks, you go into what I call survival mode. So this is when you're exhausted, you're trying to figure out this baby, you've taken 9 months for the mothers to get here, and your body is trying to get back into shape. It takes a while for you to get to what you would consider normal. And from someone who used to be in residency and on call often, this was the most exhausting time I've ever actually had after a baby. So this is where I tell all my parents, if you've got the support, we know you're awesome parents just by being there, trying to take care of the child. Take the time, use the help around you, find, if your parents are there and it's safe enough, they can come and help you for a couple hours. You can hopefully get a couple hours of sleep in consecutively, which sounds like a dream at those times. Make sure you're eating. It may not always be the warmest food, but whenever you can, make sure you're keeping your strength up with food. Make sure you get a few minutes to shower. Babies crying, I often send parents into a panic. Remember, if they're safe and someone's watching them, it's okay to let yourself use the bathroom, go shower, take a step outside. You can actually go outside and get fresh air with the baby, obviously keeping them protected from the sun and the heat and mosquitoes in the evening. But I encourage parents to take a walk outside, help them. If you find you go into the point where you're really, really down or feeling really depressed, which can happen, whether it's your first or your 6th or your 7th baby, please reach out for help too. This is not an easy time period. This can be quite difficult. So I tell parents, one of the things to avoid also is the word should. I should do dishes. I should be cleaning. I should be doing this. You may have had time before. This is where it's going to be a lot more difficult, and getting that extra hour of nap or sleep or whatever you can may be very, very important for your time to get through this. Not only are you dealing with that, but now you've got the stressors of family coming over and dealing with COVID issues and who am I going to ask and who am I not going to ask. Hopefully you're able to sit there and say, listen, honestly, I can do this via Zoom now, you can meet the baby or whatever, but we need to make sure that you guys, as parents, take care of yourself as well and are honest with people and just say, listen, now is not a good time, or I'm exhausted. I mean, I remember people coming to see me after my C-section. I was like, I see you, I appreciate you being there. I'm going to bed. I'll talk to you later. So just make sure that you take care of yourself when you need to. People understand a lot more than you think. And one of the things that I recommend is when you are doing things, try to set up little stations. I think it's a great idea to put something like some water bottles near where you're going to be sitting or feeding the baby. So if you're feeding the baby, you need to reach out, making sure you're getting water, making sure you're staying hydrated, snacks, anything where you may be sitting for quite a while. But yes, remember that you're great parents, but you're not superhuman. Allow yourself to be human at times. It's really important. Dr. Mirkin?
What can I say? We're here for you. We have I think we have 34, 35 offices, most on Long Island, some in Queens, Staten Island, Westchester, Orange County, and we're all accepting new patients and looking forward to taking care of the next generation. So, you can, if you go to our website at alliedphysiciansgroup.com, you can plug in your zip code and a radius and see who's around you. And I think that's one good way. And then if you want to vet us with your obstetrician and your neighbors, it's probably a good idea as well. And anybody, are we open for questions now? Kerry?
That's going to be next.
Okay.
So there you go. We're all here. Okay.
Oh, I
Go
have
ahead.
one thing. I have one hint on counting the baby's wet diapers, because the diapers nowadays are so absorbent, and sometimes that wetness strip doesn't always change colors. So I normally tell, especially the breastfeeding mothers, I tell them when they get home, take a Kleenex, fold it up, put it in the front of the diaper, and then you'll know for sure when the baby's diaper is wet. So that's my pearl of the
Do
night.
that too. Forgot about that. Yeah.
Yeah.
That works at the beginning, right? Although generally after that, I tell them to point it down so it doesn't end up coming out of the diaper.
Well, then you'll know they're wet too.
Yeah,
Those mysterious puddles you get from somewhere.
exactly. So Gary, I just want to point out, you mentioned, checking with your obstetrician a few times, and that's great. And obstetricians are a great source. I just wanted to mention that now that more and more of the obstetricians are being bought by hospitals and are working for other people, they don't always have the same freedom that they had in the past to make recommendations. And that's one of the great things about Allied, is we're totally independent. So we can make a recommendation to you for a specialist, an ENT, whatever that might be, a GI doctor, anyone that you might want to see. We don't have anybody telling us who we need to refer to. So just
And
something.
we can even recommend obstetricians.
We can.
By that time.
Do that, and we have to do that sometimes.
Yeah, absolutely.
One recommendation we do make, and it's an Allied doctor, but Dr. Lauren Macaluso is a breastfeeding specialist, and she's a pediatrician who has just devoted her entire practice to what she calls the 4th trimester. And now that it is, we're doing everything basically remotely and it's all telemedicine, you can be anywhere and still get a consult with Dr. Macaluso. So that would be something that anybody who's breastfeeding should really think of doing. Whether or not they choose an Allied practice, it would be something really useful for them. So a big question that came up that we didn't really address directly is visitors and COVID. So Tulika, you mentioned that you can send people home if you don't want them, but there are a lot of new moms that need that visitor. They need grandma, either to play with the 2-year-old, right, or to give them a break so that they can sleep. What's your feeling on letting in people to help us? And the other question that came up about quarantining, are you requiring parents to grandparents and whoever else might visit to quarantine? So Tulika, why don't you take that one?
So yeah, at this point, we're lucky enough that our numbers are low, but it's still circulating. And we're lucky that right now the newborns and young babies are not getting affected to a severe degree that we see the elders being affected. However, we still do recommend anybody with obviously any symptoms, cough, runny nose, anything like that, really stay away. I have had a lot of patients just say the week before, if they can do it, mom and dad, you quarantine, we'll work with you. And this way they know that they are safe to come in to the house itself. But yeah, it has to be pretty much on a like I've had people say, can my mom come from Florida? I'm like, yeah, I would kind of hold off on things like that, or traveling through airports or things. So I usually tell people if they can get here before the delivery, if possible, and kind of stay with you for a little bit, that may be your best help. Or if someone lives nearby, they can try and quarantine a little bit just to reduce the chances of transmitting it. That's probably our best bet.
I would agree with that. But I think the important thing to realize is that new moms do need help. And
Absolutely.
with all our decisions, we try and do risk benefit. So the risk of having somebody who feels healthy and well and has been relatively safe, I'm not talking about an 18-year-old who's going to graduation parties and hanging out at the beach. That risk is relatively low, and the benefit of having somebody help you, the new mom, the new dad, I think that risk-benefit ratio is definitely in favor of letting the grandparents come and hang out a little bit, and even wear a mask if that's what you feel you're more comfortable with.
They can get tested. They can also get tested. If you have the opportunity to get tested, they can get tested when the baby's born maybe, or a few days before, and get a test, and then sort of try to quarantine a little bit, and then that's even nicer.
Yeah, although we're having, lots of questions about testing now, more with the older kids. And a test is just a moment in time. So they might be negative then if they were, right, if they quarantine, that's helpful.
Right.
But,
Right.
If they were infected the day before, they could still test negative because they're incubating. So the tests are only really as good as the people's honesty of what they're doing before and after the test, right?
Yep.
Yeah.
Yeah. So this is a question. I'm going to give this one to Dr. Mirkin. Because we're quarantining and nobody's visiting, and the baby's not really being exposed to that much, can I delay my vaccines?
No. No. Everyone says they're quarantining, but I tell, we still see kids, we're starting to see kids with colds and sore throats, even though they're quarantining. You're not living in a bubble, even though you may, it feels like you're living in a bubble. You're not truly in a bubble. And, you're getting your groceries delivered, you're going out running for things. Kids can still get sick, especially babies. Even a lot of these infections that can kill a newborn and an infant are from bacteria that live in your throat. And you may have pneumococcus in the back of your throat and have no symptoms, but the baby can pick it up and have a life-threatening case of pneumonia or infection in the bloodstream or meningitis. So it's still critically important to get the babies immunized on schedule and stick with it. You're not in a bubble, even though it feels like it.
And the longer you wait to start, the longer it takes you to be finished. These vaccines are a series. It's not one and done. So if you don't start on time, then as things start to open up, or when you want to start to go out with the baby, that baby won't be fully vaccinated. So that's a big problem.
Yep. I wanted to say also, just